So have a look at the endoscopic view of the right nasal cavity. You can see the polyp lying here, and the left nasal cavity you can see the cross DNS with hypertrophied inferior turbinate. Now I am doing decongestion of the right nasal mass with the help of adrenaline soaked Merocel pack. The mucosa is being swept and also the mass is being pressed. With this decongestion I am trying to delineate the attachment of the polyp. This is the look after decongestion, very much decongested polyp. We can see this is the nasal part and this is the choanal part. Again I am using Merocel pack at the uncinate process region, because the antral part is going into the maxillary antrum through the behind of the uncinate process. Yes, you can see the part that is coming from the maxillary antrum. Now with the help of a backbiting forceps I am doing uncinectomy. It's a bit difficult because of the presence of polyp, but I'm trying it with some punches. Now we can see the polyp going into the maxillary antrum through this region. I'm trying to take out the nasal part. I'm pulling it how much I can take it intact. I'm holding it more proximally to take more polyp in intact form, because I have to send it to the histopathological examination. I have taken out some part of it, still a lot remains in the nasal cavity. Merocel decongestion may be needed time to time, especially in patients which not well prepared. As the backbiting forceps uses was a bit difficult because of presence of polyp, I am now using a Freyr's elevator to do the anterogate uncinectomy, and you can see that bubble coming out from the maxillary ostium. Yes, this is the area where I have done uncinectomy. Now with a curved sucker I'm trying to enter the maxillary ostium through the uncinectomy site. Yes, the sucker probe is into the maxillary sinus, and you can see polyp coming out from the maxillary sinus. Now uncinectomy is extended with the help of microdebrider. The remainder part of uncinate is debrided to make the opening larger so that we can take out the polyp easily. Yes, now this is a big opening and we can see polyp. The maxillary sinus is filled with polyp. This is the antral part of the polyp. I have taken another bit of nasal part. But still much more remains. I have to debulk the nasal part, then I have to work on the choanal part and the antral part. Yes, much of the nasal part is debulked. With the help of microdebrider, I am debriding the nasal part, remainder of the nasal part. Now I think there is no nasal part left. The only part left is the antral part and the choanal part. You can see there is an attachment between the antral part and choanal part. I am releasing this attachment with the help of microdebrider. See how it has been detached by debriding it. Now the antral part and the choanal part is well detached. They are separated structure now. I am putting a medusal pack over the choanal part and another one is put into the maxillary sinus through the ostium. Can see the maxillary antral part. This is the choanal part. I'm trying to push the choanal part into the nasopharynx. Sometimes it is possible to take it out through the oral cavity, but in this case it is not possible, so I have to take it out through the nasal cavity. I'm slowly taking it out. Yes, I have taken it out intact, the choanal part, and now you can see the choana and the nasopharynx, how clear it is. Now we have to deal with this maxillary antral part. A good amount of polyp is here. With 45-degree upturned Blacksley forceps, I am trying to take it out, but it is not coming in toto, it is coming out in a piecemeal fashion. I'm trying several times, but still a good amount of polyp is there. I think it is attached to the anterior and inferior wall of the maxillary sinus. With the help of a curved sucker tip, I have pushed it out, and now I am taking another part of the antral polyp. Yes. Let's see what is left. Oh, still there is something. So now a Hugh-Wasser antral gasping forceps is used. But still the rest of the mucosa is not coming out in toto. Now with the help of a 45-degree turned microdebrider blade, I am debriding the antral part of the polyp inside the maxillary sinus at the floor. I am working. It has been debulked a lot. Look, still some part remaining attached to the floor. With the help of a curved debrider blade, I have pushed it from its floor, and the prolapsed part is being debrided. We can see glimpse of the polyp at the floor of the antrum. Now again I am using 45-degree upturned Maxillary forceps to take out this part from the floor, and yes, it has come out. Now with the help of a 70-degree endoscope, I am inspecting the maxillary sinus. Look, every wall is free. There is no bit of polyp remaining there. Thank you for watching. Goodbye.